Assalamualaikum and hi to everyone. Today we want to give a talk about intervention to prevent low birth weight. So, this is our team member. First, I will talk about the definitions of low birth weight. As you can see here, there are three types of definitions of low birth weight, which is first, low birth weight. It is defined as weight at birth of less than 2,500 grams. Second is very low birth weight. It is defined as weight at birth of less than 1,500 grams. And lastly is extremely low birth weight, which it is defined as weight at birth of less than 1,000 grams. So, based on the third National Plan of Actions for Nutrition of Malaysia target, less than 8% of infants weigh less than 2,500 grams at birth by the 2025. Next.
As stated by NHMS 2016, 11.4% of Malaysian infants are born with low birth weight. 1 in 10 Malaysian infants are born with low birth weight, whereas 1 in 2 preterm infants are born with low birth weight. And lastly, 1 in 15 full-term infants are born with low birth weight. As you can see from the graph, this is the graph of trends of low birth weight in Malaysia starting from the year of 2010 to 2016. In the year of 2010, the percentage of low birth weight in Malaysia is at 11.19%, whereas in the year of 2015, it is at the highest peak, which is at 11.53%, whereas in the next year, which is 2016, the percentage of low birth weight in Malaysia is at 11.41%.
Assalamualaikum and hi everyone, I'm AINA, your third presenter for today. Do you know what is factors that can contribute to low birth weight infant? Okay, let me explain a few factors that can contribute of getting low birth weight infant. First is maternal age, which is younger mother, those under the age of 19 tend to get low birth weight infant. And also mothers age 40 and above also at risk of getting low birth weight infant. The second factor is a mother's health, which is mothers that are vulnerable to illegal drug, tobacco use, and alcohol are more likely to have low birth weight infant. Not just that, mothers who are underweight or obese also have high risk getting low birth weight infant. So my advice to mothers out there, you should monitor your weight before getting pregnant. So the next factor is a socio-demographic factor, which is mothers who come from lower socio-economic status tend to get poor pregnancy nutrition, inadequate prenatal care, and pregnancy complication. And the last factor is a multiple birth, which means mothers who give birth multiple babies such as twin, triplet, or quadruplets are at increased risk of low birth weight infant because they are often premature. So that's all from me.
Do you know what can happen if you are having a low birth weight baby? Yeah, your answer is correct. So, based on my slide, you can see that the baby are not growing like a normal during their childhood. Basically, low birth weight can cause intellectual disabilities. These are the problem with how the brain works that can cause a person to have a trouble or delay in the physical development, learning communication, taking care of himself, or getting along with others. Yeah, yes. When the child become adult, it can increase the incidence of the disease, like you say, diabetes mellitus, hypertension, and cardiovascular disease. And also, it can cause the girls to have a small baby when they become a mother. Yeah, so do you have any question? No? Alright, so let's move on to the interventions of the low birth weight that will be presented by ALIFAH.
So, I've received some questions from our audience if we can reduce the occurrence of low birth weight. The answer is yes. For intervention, we have two levels, which is country level and community level. For country level, this is the role of our government, which they have to initiate a food distribution system, especially for subpopulation that are at risk of food insecurity. And secondly, they have to improve the facility-based prenatal care in the region with low coverage. And second is the community level. For community level, we have to promote smoking cessation because maternal smoking or exposure to smoke will increase the prevalence of low birth weight. And also, we have to prevent from the incidence of malaria during pregnancy. The third one is the pre-pregnancy intervention. So, is this necessary? Yes, it is. All women right here should consider birth spacing before thinking about getting pregnant again. And also, we have to take pre-conceptional daily folic acid supplementation for reduction of the congenital abnormalities. And lastly is the antenatal care intervention. For all women, we have to always monitor and evaluate our fetal growth and neonatal size to ensure that our baby is growing in a healthy way. And also, we have to promote a daily iron and folic acid supplementation during pregnancy. And for selected women, for example, women that are at risk of preeclampsia. So for this woman, they have to take antiplatelet agent before 16 weeks. And for women that are at risk of preterm birth, they have to undergo progesterone therapy. So I have a question for all of you. Can we reduce the occurrence of low birth weight by nutrition? The answer is yes. All pregnant women should consider to take oral supplementation with vitamin A, which can reduce the occurrence of low birth weight by 33%. And calcium or low dose calcium can reduce the low birth weight by 80%, which is very high. And zinc can reduce the low birth weight by 61%. And lastly is the multiple micronutrient. So multiple micronutrient can reduce the low birth weight by 10 to 14%. And also, they can improve the woman overall nutritional status, which is very good. So all these 4 supplementation is very good for pregnant women. So that's all from us. Do you have any question to ask? So there is no question. Okay. So this is the reference that we use to conduct this talk, and that's all from us. Thank you.